Hello and welcome to another video. In this video we're going to go through a case study which is quite different from other videos we've done. I hope you guys enjoy it, and don't forget to like and subscribe to the channel, and leave a comment below if you want to have any suggestion or any query. Let's go. In this case, you got a new patient that's come to your office, and you're presented with the details. Let's get background. She's a 20-year-old female. She's a student, and a main complaint is insomnia. Okay, so the first thing you're thinking about, okay, sleep hygiene and all that. Well, let's get straight into it. She walks into your office, you present yourself. So you start with an open question: how can I help you today? So she starts straight away with, I'm finding it hard to sleep. I go to bed but stay awake for hours, and I only manage to get about 2 hours sleep in total. Now I'm not able to concentrate during lectures, and I'm afraid I won't pass my exams. So that seems to be the main worry in this case. So you're going to ask more questions like, onset, isn't it? When did you first notice the change in your sleep pattern? It's like just to find out what is going on. She says about 3 months ago. However, as she says that, she becomes more tearful. She starts crying, and obviously, you quickly provide a tissue to wipe her tears. Let her calm down. You settle the tone and get reassure the patient. Okay, and as you're reassuring the patient, you decide to assess some mental health. Okay, so you use the acronym SAFER. We're gonna go through it, and hopefully this will help you in your practice. So S stands for sleep. So we've already asked about the sleep anyway. She's already told us much of it, but in case it was a different type of presentation or case study, you will ask, how is your sleep, or how is your sleep pattern? A stands for appetite. So just go straight into it. Have you noticed any change in your eating habit, reduced appetite? Focus and concentration levels. Like I normally go with any change in your concentration level, or are you struggling to concentrate? You just can't concentrate enough. And E stands for effect on work, relationship, or hobbies. Now, there's a variant to this, is what we call anhedonia. Okay, but that's kind of like it answers that question. Okay, so you will ask, is there anything you still enjoy doing? They'll probably say yes or no, and expand from there. So obviously, you want to assess risk. In every patient that you suspected like a mental health issue or mental health presentation, always assess the risk. Any suicidal thoughts, don't be afraid to ask that question, because people are quite blatantly answer the question. Okay, so she replies, I wake up tired all the time. I just can't concentrate. I go back home and I sleep during the day, but then I can't sleep at night. It's like a double whammy. Okay, and she says no, she doesn't have any suicidal thoughts, but she feels low because she feels basically her mood is low because she feels that she can't concentrate. She can't do what she's expected to do as a student. So the consultation continues. So you ask a bit more question about the family history, social history, past medical history, and psychiatric history. Well, you don't find anything of significance. So you go ahead and perform a physical examination. She's basically fit and healthy. So you decide at this point to write down some notes about her mental state. So this is just for your own learning purposes. I think something you should be aware of, which is the mental state exam, which allows you to assess the mental state of the patient. So the acronym for this is aseptic. So I'm going to break it down for you guys. So A stands for aspect or appearance plus behavior. So in this case, she looked fit and healthy and appropriately dressed for the weather. She was tearful at times during the consultation, but generally her behavior was pretty normal. And she also maintained a good eye contact. Okay. S is for speech. So in this case, her speech was fluent, good rate, good tone, good volume. E for emotions. She described her emotions subjectively was low. But obviously, if you want to write it objectively for your own point of view, I think a mood, you can kind of like say that it matches our own personal emotion. So P for perception, is basically, are they responding to any external stimuli, hearing voices and stuff like that. In this case, she didn't appear to be responding to any external stimuli. Now, any thoughts? This could be suicidal thoughts or stuff like that. In this case, obviously, she has, the only thought I could think about is that she's afraid of not passing the exam, which may have detrimental impact on her mood. But yeah, other than that, it's pretty normal. I for insight. So are they aware of their mental state? Yeah, she does have insight that she might be low. She's even saying it herself. Obviously, she's attributing that mainly to the insomnia. Cognition, she's aware to time, place, and space because she did come to visit you in your practice. So, what will be the management plan? So, you got a patient that's presenting with insomnia. You find out that she's a bit low in her mood, and you go through, like, the acronym, SAFER, and you also do a MSc. Okay, so what will be your management plan? Okay, so in this case, A, would it be supportive counseling like CBT, talking therapy? B, you would like to start on antidepressants such as sertraline, citalopram, fluoxetine, the SSRIs or whatever. Or do you want to go for both, counseling and antidepressant? In this case, because I think her risk is quite low, she's not presented before to the clinic, I think the best thing to do is for you to at least start by sending her to the counseling and see how she goes with that. And that's it for this case. I hope you guys really enjoyed it. It's very short, very quick. And yeah, don't forget to like and subscribe to the channel, and see you guys in the next one. Goodbye.